If a person is experiencing any pain or bleeding, especially after clearing the bowels or after passing stools, most of the people assume that it is because of piles. But what most of the people are not aware of is there are many other diseases in the same region, such as fissure, fistula and hemorrhoids, etc. in the same region which can cause the same symptoms. So in this video, we will detailedly discuss about what is the difference between piles, fissure and fistula, and what will be the possible symptoms in these diseases and what are all the treatment options for the same. So let's start the video. Before we dive deep into the topic, let us first discuss about the anatomy or the structures that are there around the anal canal. So in this image, what we are seeing is a replica of the anal canal, where this part can be divided into two parts. The uppermost portion is referred to as rectum and the lowermost portion is referred to as anal canal. So for a layman to understand, this upper portion, rectum, can be compared to a dam, and this lower portion can be compared to a dam gates. Whenever there is filling of this rectum with the stools, it sends signals to the brain so that whenever the load is full, it sends signal to the brain to clear the dam. So to clear this dam, what the brain will send signals to these structures which are referred to as the sphincters. Because of these sphincters, we are having control over the stool. Not only over the stool, we are having better control over the flatus also, and all these are possible because of the sphincters surrounding the anal canal. So let's discuss in detail about the piles, fissure and fistula. So to start with, let's discuss about the piles. Why these piles happens and what will be the possible symptoms and what will be the treatment option. If you notice deeply, we have some three dot-like structures. These dot-like structures are referred to as anal cushions. So what these anal cushions does, or what is the function of these anal cushions? So let's assume this anal canal as an open pipe. If the pipe is like this, there won't be any control over the stool. So the stool and the gas will be passing just like that. So the anatomy or the architecture is made in such a way that we should be able to hold the stools, but at the same time we should be able to pass the gas. So to serve these purposes, how the anal canal has been architectured is, with the addition of this anal cushions, it will be turned into a cushion-like structure. For example, assume this as the anal canal. If it is just like that, there won't be any control over it. So that's why in this anal canal also, there will be some infoldings just like a spokes of a cycle tire, so that these infoldings will act as a cushion where these will be able to hold the stool from falling down, whereas the gap between the cushions serve as the gap so that the flatus, there should be any problem while passing the flatus. So I hope you are understanding this. So if anyone is causing much pressure and repeated pressure over these anal cushions develops into piles. As you are able to see here, these dots can be compared to these anal cushions, and once there is pressure from above for long duration, be it for months or years together, these anal cushions start slowly progressing in size, increases in size, gets swollen, and if it is in initial stages of piles, it will form just a bump-like structure, and in advanced stages of piles, there will be some visible bump that is coming in and out whenever patient is passing the stool. So these anal cushions pressure leads to piles. Now we'll discuss about what is fissure. Fissure is nothing but a small cut over the anal canal which happens after a prolonged straining of stools. If we compare the differences between the piles and fissure, in both the cases bleeding can happen, but there will be difference in the type or the pattern of the bleeding. In piles, there will be drops of blood that will be leaking once the bowels are cleared, whereas in a case of fissure, there will be a small linear cut over the anal canal. That's why patient can appreciate mostly a blood stained stool or a line of blood over the stool. And symptoms wise, how patients will experience symptoms in a case of fissure is, patient with a fissure will have more of a pain compared to the bleeding, and he may or may not have bleeding at all, but he will experience pain after passing stool, which may last for half an hour to 3-4 hours or 5-6 hours or the entire day as per the severity of the fissure of the disease. Whereas in a piles, most of the case of piles are painless unless until it is a grade 4 piles or an advanced pile, or if there is a thrombosed hemorrhoid, means if there is this pile mass, if a clot develops within the pile mass, then it is referred to as a thrombosed hemorrhoid. So for this fissure to develop, it takes one single episode of constipation or passage of a very hard stool. So why this fissure develops means, this fissure can be compared to a rubber band. So generally the anal canal exists like this. Whenever we have to pass stool, it opens to a certain extent, and immediately after passing stool, it closes and comes to normal position. So it's just acting like a rubber band. If there is sudden severe tension over the rubber band, this rubber band may break away. In the same way, if this anal canal breaks away, it is referred to as fissure. For this fissure to develop, one single episode or one single day is enough. Whereas for the piles to develop, it takes months or years of constipation together, which all gets pulled up and leads into piles. Apart from this piles and fissure, there is another disease called as fistula. How these piles and fissure are different from fistula is an infective disease or an infective pathology. What happens in a case of fistula is, there will be an abnormal communication between the anal canal and the skin. So there will be a tunnel between the anal canal and the skin. So what symptoms or what manifestations can patient experience is, he or she can notice a small pimple or a small swelling around the anal canal, and that pimple or the swelling may discharge pus, or occasionally it may discharge blood also, and the pimple won't be active throughout the month. Pimple will be active for around 5 to 10 days in a month, and the rest 15 to 20 days patient will be completely devoid of or free of all the symptoms. Why patient is having a symptom free period in case of fistula is, as discussed, there is an abnormal fistula is nothing but a communication between the anal canal and the skin. So what as discussed, patient will experience a pimple with pus discharge or blood discharge only for few days in a month. Why he is asymptomatic for the rest of the period of the month? As said, for the bacteria in the stools to reach the outer portion, it takes time. So that's why for the bacteria to reach from here to here, till that time patient will be completely symptom free. But once the bacteria and the infection gets pulled up and gets opened onto the skin, then he will experience a bump or a pus discharge or a blood discharge. Otherwise, rest of the month he will be symptom free. So to summarize, piles is nothing but we are causing pressure over the anal cushions so that there will be bleeding and there is some mass coming out from inside out in a case of piles. Piles are mostly painless unless until it is a thrombosed hemorrhoid or it is an advanced hemorrhoid. Next, discuss about what is fissure. Fissure is nothing but a cut which happens after a single episode of hard stools, and this fissure will manifest more as a pain rather than the bleeding, which may vary from half an hour to 5 hours, 6 hours or the entire day as per the severity. Another difference which a patient with a fissure can experience is he or she can experience that his anal canal is getting closer or getting closed or tighter day by day. If this symptom is being experienced by the patient, it should be mostly because of the fissure. And as said, in case of fistula, there will be a pimple or a swelling in and around the anal canal, and he or she can experience a pus discharge or a bloody discharge on and off. I hope after seeing this video, you should be able to figure out whether you have got a piles or fissure or fistula. If you are still unclear about piles, fissure, fistula, you can check out for the remaining videos in our channel where we'll be briefly or detailedly describing with animations and pictures. And if you still have doubts or if you want to clarify further, you can contact the below mentioned numbers. Myself, Dr. Abhilash, consultant laparoscopic surgeon and laser proctologist from Hyderabad, Coimbatore. Thank you.